I'm Dr. Benjamin Visger, and this is a reflection on the healing process when it comes to pain. Many people who have lived in pain are used to long and incomplete results. Sometimes the road looks like a steep climb, and they have no idea where it ends. What I'm here to tell you is there are sometimes faster roads. They may seem broken, they may seem difficult or dangerous. Okay, let's see if I can make this in my Sunday best. But if you know what you're doing, or at least you have a good guide. This log is very wet, by the way. It's been raining all day. If you have a good guide, then it's not so bad. So, what does that have to do with healing? Well, most of my patients come to me having already tried massage, chiropractic, physical therapy, injections, medications, and they feel like the road is blocked. But there's a lot that's right underneath our fingers. A lot of really easy answers if we only just look. For example, I find spots in my patients that were there, muscles, nerves, joint restrictions, that were there every time those people went to their doctor. And yet, apparently I'm the first to find it. Well, that can be a little bit tender, you might imagine, to find and work through pain that's gone undiagnosed and untreated for years. But again, the nice part is we actually get better. So just like, oh, okay, don't fall in the river, doc. So the road may seem bumpy at first. Many of my patients are surprised to find where the root pain is coming from. Once we get it, boy, not only have their eyes opened, but their life begins again. So to me, would I rather tear the Band-Aid off as slowly as possible, taking months and months to experience some partial, incomplete cure, or get right down to the true pain and fix it? That's my choice. So, in terms of doing unto others as I would have them do to me, boy, I wish someone would do that to me. So, you're welcome for when I do it to you. Now, after releasing a patient's true pain, how long does it take to really heal? I can tell you a very general ballpark is 6 to 8 weeks. That doesn't mean that we are in pain that entire time, but it means that upon treating that true pain, ideally, the true pain would stop and not return, especially if I follow my instructions of what to do, what not to do. But over the next several weeks, indeed, some discomfort could wax or wane, and it would be common. I don't truly say normal in terms of that it's good or should be expected, but we'll say common. Okay, mud. Aha! I didn't suffer any true pain there, did I? Let's watch a little more closely at this mud. Yeah. Okay, doc. There we go. There's some wood under my feet. That's a perfect illustration for how slippery the road can be to recovery. That is, it's common for my patients to experience some bad days even after the healing has begun. Again, not truly required, not absolutely essential, and I believe in almost all cases completely avoidable. But even if they have some true pain, or they even come back to me saying, I'm back to square one, doc, I'm starting over, it's just as bad as it ever was. It never is. I'll say it again, it never is, never has been in my 13 years of clinical practice at the time of this recording. So even when someone's pain feels like it's as bad as ever, when I get my hands on them, we both see that it's really only partially returned, and yet some manner of inflammation has exaggerated the symptoms, and they get back on track. So if I say to you 6 to 8 weeks is an ordinary or average or perhaps generously ballpark amount of time to recover from pain, to heal, well, what affects that? Certainly brand new acute issues that have never happened before and really have nothing else related to them, those can improve very quickly, such that it may just be a matter of that day or a few days, maybe a few weeks, and they're really completely better, at least symptomatically. Or if someone has quite a chronic issue, a very difficult, very stubborn, long-standing, maybe surgical, maybe a traumatic issue, well, that person, of course, should expect a slower and perhaps incomplete recovery. Wait, am I saying that not everybody gets all the way better? Well, when it comes to true pain, my hypothesis is that everyone can get all the way better. But that's a hypothesis, and it's up to you and me to prove or disprove it. So the more chronic, the more traumatic, the more surgical, the more compounded the issue, the more difficult. Oh, and I should say, when I describe with the word compounded, I mean a person who has just one problem has hardly any problems at all. Think about that. If only my neck is tight, but my head's on straight, my shoulder feels great, my posture is well, my lower back is fine, my hips are aligned, then I would not even be in to see the doctor with just that. But if my neck is tight and my shoulders are tight and I suffer from headaches and I've had an upper back injury, some broken ribs, and I had lower back surgery, how easy is it going to be for me to fix my neck? How quick is my recovery going to be? So I think you're starting to understand the road to recovery and what variables affect it. So you may look for yourself, what is your path going to be? Now, that's really only the first phase of healing, but that's a phase that patients are truly concerned about. After all, after that, if they have succeeded, phase 2 is much more mellow and much more slow. So phase 2 can take several months, where there may be some brief, mild returns of the pain, but nothing substantial, and it's a matter of practicing and rehearsing what we already know to do and not to do. In fact, the healing continues over probably 1 to 2 years. So, such that a person who does well continues to build credit during that time and becomes farther and farther from pain ever again. Of course, pain can always return. If I return to the same habits I've always had, if I take poor care of myself, if it becomes re-injured, of course it can return. But after building such credit, when that pain hits, it will hardly have a foothold. It's sort of like coming out of debt. If I come out of debt and establish an emergency fund and start to build up my savings account, then even when hard times appear, they won't hit me as badly as they did before. That's what I think of for healing from pain. I also think of it like weight loss. If I'm trying to lose weight, whatever diet allows me to lose weight is the same diet that will keep the weight off. And if I lose the weight and then return to all the foods I've ever eaten, that weight is on its way back in no time. In fact, it'll come much faster than it left. The same is true of pain. Whatever habits, whatever lessons I learn to cure it will be the same lessons and habits that keep it away. My favorite example of this is when I've hurt my back badly before, I could not bend. So I could not put my shoes on, I could not reach my socks. And I teach patients every day with back problems to avoid bending. Well, there I was, unable to bend. So I had to start squatting and moving more robotically. And indeed, my back pain recovered quickly. Well, if I maintained a better habit of avoiding bending strains, I would never have ended up there in the first place. So, I hope this gives you a good idea of your healing journey. And the fact is, everyone is different, yes, but these truths are general and widely applicable. So, for me, if I can heal from true pain, then I can handle anything that comes my way. Even a little patch of mud while wearing my Sunday best. I'm Dr. Benjamin Visger, and there is an easier way around this.